When we make the diagnosis of metastatic disease, at the moment we do not really have so many treatment options. In general, and if you look at most guidelines, we would recommend systemic therapies. However, this might not always be required, and I think it really depends on the extent of metastatic disease. Sometimes we have patients that have just small lymph nodes or like 1 or 2 metastases in the lung and the main tumor burden in the liver. I think these patients are also candidates for local therapies, with all the caution I have mentioned before that we should not overuse local therapies, but I think we should also not underuse local therapies. And it could be a mixture. So if the main tumor burden is within the liver and we have only small and few extrahepatic metastases, I think we can start with local therapies. If we have more extrahepatic disease, of course, these are patients that require systemic therapy.
In every patient who has a big tumor mass in the liver and there's only small metastases, so you can, for example, imagine a patient who has a big bulky liver disease, 10 centimeter large tumor, and only some small lung metastasis. Such patients, they will die from liver failure and from the local problem. And probably they won't die from the small metastasis in the lung or some small bone metastasis. On the other way, patients who have just a few small tumors and have really big metastases and also metastasis in the bones, which is quite common, or infiltration of other organs, in such patients I would recommend to start systemic treatment. We don't have really good stopping algorithms for patients receiving TACE. What we know, just not as a predictive way, but on a prognostic way, that patients who show hepatic decompensation after TACE, they have really short overall survival. But we don't know really how many cycles of TACE we can apply to the patients. In my daily business, and I think also many others do it like this, if we don't see any effective effects of 2 or 3 cycles of TACE, we stop the TACE and we try to do a systemic treatment, because the patient is really, he can get liver failure, and then we do not have any options for him anymore. So always consider, if you have a deterioration of liver function after TACE, please consider systemic treatment. But we have to do trials in such patients how many cycles we can do, and then we have to switch to systemic treatment.